everybody, it's Dr. Wise. We're here for an FUE, or Follicular Unit Extraction hair transplant this morning. A really terrific patient. He's a 38-year-old man, totally healthy guy, living his best life, and he does have some concerns, however, about his hair. Particularly, he's got some fairly significant thinning of his hairline. So he's got the typical pattern that we see for male pattern baldness, or what's commonly referred to as androgenic alopecia. Basically, normal hair loss for a man, very common in 20s, 30s, 40s, 50s, etc. But basically, he's missing quite a bit of hair in the front, and he wants to kind of regain his confidence, and he wants some hair, and he wants a permanent solution. So that's what we're going to do today. How are we going to do it? We're doing an FUE technique. We're doing probably around 3,000 grafts. When we say 3,000 grafts, we don't mean 3,000 hairs. That's actually an important concept to know, because 3,000 grafts are way different. What we mean by that is that each hole in your head, if you look under a microscope or some sort of magnification, each hole in your head has hairs that come out, of course. And the hairs could be either single hairs, double hairs, triples, and sometimes quads or 4 hairs. Most people have a pretty good mix, so that we actually preferentially draw out a multitude of different grafts to create a more natural look. We like to preferentially place single hairs in the frontal hairline to make it look a little more realistic. And then as we move back, we want density. We like to get some of the bigger grafts. All these grafts naturally occur in the human body. When we say 3,000 grafts, if someone has a different amount of 1s, 2s, and 3s, you're probably looking at anywhere between 6,000 and 8,000 hairs. You have to shave the patient's heads for these procedures. And when I say that, I don't mean the entire head. I just mean the donor. So you're literally, the only part of the head that's trimmed is the back. There are some guys who like to cut their whole heads just to make it kind of more uniform, but certainly it's not necessary. If men particularly get kind of like a high skin fade at their hairdresser or barber before the procedure, it looks extremely seamless. The nice thing about this procedure as well is that not only do we do an FUE procedure, but we really do something called a micro FUE. And what that means essentially is that the punch is only 0.5 millimeter in diameter, meaning it's so small that it's essentially the size of a small needle. That means that the trauma to the back of the head is usually minimal. It means that we can get many grafts in one sitting. And most importantly, we can get many grafts without causing any trauma to the other hairs. And usually patients heal extremely quickly from this procedure, so much so that within a few days you really can't see anything in the back. It's absolutely incredible. Good morning.
Good morning.
How you doing, brother? Good to see you. How you feeling?
All right.
Excited?
Yes.
Yeah, me too.
I'm excited. Yeah.
Awesome, man. I'm excited
Yes.
too. Let's take a look at the merchandise here, man.
All right.
See what we got. So we can just kind of get a good look at the hairline here. Let's see what we're gonna do. It's gonna be great. Good news is your donor's outstanding, so we're gonna be able to create a really nice hairline for you. We'll feather back a little bit too to make it a little full. We don't just want to fill in the area where you don't have a lot of hair right this second. We also want to kind of extrapolate a little bit beyond the curve, meaning like we want to go a little bit further back to where you might lose a little more hair too, so that you're covered now, but also, moving forward in the future. So should be terrific. All right, we'll draw a hairline for you, and then we'll have you take a look. You tell me what you think. We'll kind of figure it out together. The most important thing is we want to keep it natural looking. So the best transplant, best FUE procedure is the one that no one ever knows about. Drawing a line, it's not really going to be a line. This is just a guide, and then we make it irregular so it looks like a normal hairline. No one's hairline looks like a perfectly straight line. It looks a little bit irregular. Okay. So that's part of the artistry. We want to make sure it looks really realistic for you. Just the guide. So we're going to fill in all this area here. We'll feather this a little bit too, so it'll be kind of a little bit irregular here as well.
All right. Thank you. Cool.
So now our patient here is nice and numb, and we're going to take a few samples just to kind of see how the grafts are positioned, the depth. It's kind of like our own little reconnaissance mission for the first few, just to see how we're looking, and then we'll start extracting them. We'll probably have about 300 to 3,500 grafts to take today, so we're excited to get going. This is just a really, really excellent sample of some of the grafts that we've taken, but you can see how each graft is kind of unique. And so this is a really clear example of what we call a single graft. So this has one hair coming out. This is a really beautiful display of a double, which is two hairs that are coming out. This is a triple. You can see the 3 hairs fairly clearly here. And then our 4-leaf clovers. This is a quad, or a 4-hair graft, which is really, really nice. How we take care of the grafts, once we extract the grafts, we actually place them in a very, very unique solution. This is called hypothermosol. This contains nutrients. It's called what we call a holding solution. And what that means is we actually store it on this special device here. This is called a chiller. And we actually store the grafts in what we call a hypometabolic state. And what that means essentially is that the grafts are in a special solution that's kind of a similar solution to what you would actually hold organs when you do organ transplants. This is like really, really great stuff. And we cool it exactly at 4 degrees centigrade. The combination of the holding solution with the temperature creates the best grafts possible. We want to make sure the ex vivo time, meaning the time that the grafts are out of the body before they're implanted, is minimal. So at most, we keep them in this holding solution for only a few hours. But it really turns out some great grafts and really, really good viability or survival of the grafts. Our survival here at this facility probably is anywhere between 97 and 100%. It's really, really good. Let's take a look here. Nice. So we're at 2 weeks. And how the last few weeks been? Everything okay?
Yeah, it's been really good.
That's great. Awesome. Yeah, it looks really good. Let me see back here. The back is remarkable. I mean, you can see like it was just no sign. I mean, it's completely normal. And your hair grows pretty fast too. It's nice.
Yes.
I mean, I don't think your hairdresser would even notice this. I mean, it's pretty cool.